So this is a little combination of benzoyl alcohol, bacteriostat, saline, and lidocaine, just to start the injection here. Hold still, my dear, just very gently. And that's just to make the injection less painful. TEL, Tumescent, Epinephrine, Lidocaine. Do you feel anything, my dear?
Just pressure.
There's pressure, okay. Tell me if it's uncomfortable. I'll go slowly. So this will help us achieve really good hemostasis when I do a biopsy on the scalp. The last thing she needs is having a problem with bleeding after a biopsy today. There's 5 milliliters of tumescence. Okay, there we go. Nice little goose egg there, 10 milliliters of tumescence. We'll let that take effect for a few minutes, and then we'll do a biopsy. Start. It's completely anesthetic, but I want to optimize the vasoconstriction, so we'll give a little more lidocaine with epinephrine, 1% lidocaine with epinephrine. And because there's vasoconstriction out here, the lidocaine and epinephrine will stay where I want it for a longer period of time. So we'll hold some gentle pressure on there for a few minutes, and then we'll do the biopsy. 3 by 2.2, 3 by 2. Did you feel any pain for this procedure so far? No pain, okay. We've done a little biopsy. There's hardly any bleeding. And we'll keep a little pressure on it to minimize any bleeding. And she's ready to go home. We'll give her wound care instructions, which will include washing this 4 times a day with some foaming cleanser, surgical post-operative foaming cleanser, and then spraying it with hypochlorous afterwards. So foaming cleanser for 20 seconds, 30 seconds, and then wipe that off and spray it with hypochlorous, and that's the end of it. So we've done a 3.5 millimeter punch biopsy in a vascular probable squamous cell skin cancer. She's on Xarelto and aspirin, and there's minimal bleeding. There's some ooze, so we'll put some pressure on there for a while, and then we'll be done. Go ahead. This is our technique for doing minimal invasive wound care. We just put a little foaming cleanser on here, HK foaming cleanser, and we just apply it like that. We leave it on for about 20 seconds, and then we wipe it off. And then we spray it with some hypochlorous. Wipe it again. Spray it once more, hypochlorous, and we're all done. Do that 4 times a day.